Chapter 28 Oncology. A. Neoplasms is an abnormal new growth of tissue. Malignant neoplasm cancers are likely to spread and cause serious illness or death. Benign neoplasms do not spread and are less harmful. When speaking to patients, doctors generally say growth or tumor. You have a small growth and tumor in the bowel. A lump or swelling is a collection of tissue or fluid which is visual or pulpal. Can be pulped or felt with the fingers. A lump may be due to an neoplasm, but there are other causes such as inflammation or fluid accumulations. Patients say I have a lump in my left breast, and doctors say there was a firm pulpomace in the liver. Malignant tumors are characterized by rapid growth and invasions. The tumor may invade local tissues or may spread to distant parts of the body. Neoplasms, which are the result of metastasis, are called secondaries as opposed to the original tumor, which is the primary. We have the result of the scan back now, and I afraid they show that you have a small growth in the prostate. Fortunately, it appears to be in an early stage and there is no sign of a spread. So if we remove it, there is a region of complete cure. B. Symptoms and signs of malignancies. The symptoms of malignant disease may be related to the size and location of the tumor. For example, a space correlation in the brain causes raise intracranial pressure and symptoms such as headache, vomiting, or visual disturbance. Tumors of the colon may obstruct the lumen and cause change in bowel habit. Other possible symptoms of malignance include bleeding, pain, and weight loss. And C. Treatment of tumors. A tumor can sometimes be completely removed or excised by surgery. If this is not possible, for example, if it has already metastasized to other parts of the body, it may be possible to destroy it by radiotherapy or by chemotherapy. When a cure is not possible, palliative treatment is given, which is only intended to relieve symptoms. Capítulo 28. Oncología. A. Neoplasias. Crecimiento anormal de tejido. Malignas, cáncer, benignas no se diseminan. Conceptos: invasión, metástasis, tumor primario o secundario. B. Síntomas de malignidad: dolor, sangrado, pérdida de peso, obstrucción, síntomas neurológicos. Y C. Tratamiento: cirugía o incisión, radioterapia, quimioterapia y tratamiento paliativo. Chapter 29. Pregnancy and Childbirth. A. Childbirth. The expected date of delivery is date on which a woman is expected to give birth to a child she is carrying. It is calculated by adding days or 40 weeks to the first day of the last menstrual period. Childbirth is also referred to be doctors are partnering. Delivery is the process of helping the child to born. A spontaneous vaginal delivery is a normal delivery. Is there are complications, The baby may be delivered by sensory sections. A full-term pregnancy is 40 weeks divided into three trimesters. A baby was born before this a premature, and one born after 30 weeks is postmature. A baby was born dead, for example, because the umbilical cord is around its neck. Is stillborn. A pregnancy may be 4 times spontaneous with a miscarriage or be delivered terminate, which induced abortions. B. Labor. The process by which the fetus and placenta are pushed out of the uterus is called labor. It is divided into four stages. Some words which are combined with labors are premature, prolonged, spontaneous, induced, and false labor. And C. Presentation and lie. Fetal lie is the position of the fetus in the uterus. The normal lie is longitudinal, and the abnormal lie is transverse. Fetal presentation refers to the part of the fetus which occupies the center of the pelvic canal in which the examining fingers feels on vaginal termination. The normal presentation is with the head. Breast presentation means the buttocks are presented. A normal presentation may require delivery with forceps. Ahora en español, capítulo 29, embarazo y parto. A. Parto. EDD es igual a la fecha estimada de parto. Embarazo a término, 40 semanas. Prematuro, menor de 40. Posttérmino, mayor de 40. Aborto espontáneo e inducido es igual a terminación. B. Trabajo de parto. Expulsión del feto y placenta. Tipos: prematuro, prolongado e inducido. Y C. Presentación fetal. Longitudinal es normal, transversal es anormal, cefálica es por la cabeza y podálica por las nalgas. Chapter 30, the respiratory system. A. Cold. Cold is a common symptoms of upper respiratory tract infection and lung disease. A cold may be productive where the patient comes up sputum, or non-productive where there is no sputum. A productive cold is often described as loose and non-productive cold as dry. Sputum may be clear of white, yellow due to the presence of pus or blood staining. A doctor is examining a patient who is complaining of a cold. Doctors, Mr. Hamilton, how long have you had the cold? Oh, oh, 4 years. Do you smoke? I used to smoke heavily, but I gave up a year ago. Do you cough up any pollen? Yes. What color it is? Usually yellow. Have you ever noticed any blood in it? No. Any problems with your breathing? Yes, I get very short of breath. I have to stop halfway up the stairs to get my breath back. The doctor's right is the patient's cause note. The snow and cold Portland sputum for years. No hepatopsis. B. Auscultation. The doctor is examining Mr. Hamilton's chest. Take deep breaths in and out through your mouth. Good. Now say 99. Listening to chest with a stethoscope may reveal the presence of sounds apart from the normal breath sounds. There are two main kinds of added sounds: crackers, which sound like hairs being rubbed together and suggest the presence of fluid in the lungs; voices, which are more musical sounds, like whistling, and indicate narrowing of the airways. The sound head when the pleural surface are inflamed and as in pleurisy is called a pleural rub. The doctor asked Mr. Hamilton to say 99 to check vocal resonance, which may be increased or decreased. After examining Mr. Hamilton, the doctor added to his note chest, early respiratory crackles, both long bases plus expiratory west. Capítulo 30. El sistema respiratorio. A. Tos. Puede ser productiva con esputo o seca. Esputo es mucoso, purulento y con sangre. B. Auscultación. Sonidos crepitantes o líquido, sibilancias, estrechamiento y roce pleural. Chapter 31. The skin one. A. Some types of skin lesion. Medical term: muscle, common word: spot, features not rise above the surface of the skin. Papule, spot rise above the surface of the skin. Nodule, lump, a large papule. Vesicle, small blister filled with fluid. Bulla, blister, a large vesicle. Pustule, filled with pus. Cross, scab, dribble, etc. on the surface of the skin. Skulls, a thin layer of epidermis separated from the skin. Cicatrix, scar, a mark of the skin on the skin after healing. Nables, birthmark, a colored skin lesion present at birth. Note: the leak of often yellow fur as a result of infection is pus. If a lesion is pustular, it is filled with pus. B. Rashes. A single skin lesion can be regular or irregular in shape when there are many multiple lesions, especially macules of papules. The result is a rash. For example, the rash of an infection, disease such as rubella. A rash is said to erupt or break out. My little boy has broken out in spots in a rash all over his body. The following features of a skin lesion are usually noted: location, size, shape, color, and types. For a rash, note also distribution and grouping. Capítulo 31. La piel 1. A. Lesiones cutáneas. Macula plana, papula elevada, nódulo, masa, vesícula, líquido, pústula, pus, costra y cicatriz. B. Erupciones. Características: localización, tamaño, forma, color, distribución y agrupación.